we are definitely seeing an increasing transmission in South Africa, and we're seeing a number of increasing reports around the world of the Omicron variant. There are some challenges in our understanding of how much this is circulating because we do need sequencing to determine if it's the Omicron variant or we have this S gene dropout with one of the PCR assays that gives us a clue of if it may be Omicron circulating. One of the things that we're really looking at right now is how Omicron will circulate in different populations. In South Africa, for example, they had just finished a wave of infection with Delta. And so transmission with Delta was at a very low level. They worked incredibly hard to bring that transmission under control and should be congratulated for that. And with the emergence of Omicron in the population where Delta was low circulating, where it was not circulating very much, Omicron really took off, and it really is increasing in transmission around the country. Now, what we have to look at is how Omicron will unfold in other countries, other populations that have Delta circulating at a high level, and what will actually happen as Omicron, if you will, competes with Delta, and whether or not we will see the same increased growth rate, the same increasing number of cases over time in different populations. We expect to have estimates, good estimates of the time varying reproduction number as it compares with other variants in the coming days. There are some early estimates of this, but the confidence intervals are very wide. I think one of the things we need to stress right now, and the Director General said this in his speech, how countries react right now in the next days to weeks. I'm not talking about reacting in January or February, but in the way countries react now will determine how Omicron unfolds, no matter what we find out in terms of its transmission, its severity, its impact on our countermeasures. So we can't stress enough how important it is to act fast, to act robustly, and I don't mean lockdown. We mean using proven public health tools to drive transmission down in areas where transmission is high and to keep transmission low in areas where transmission is low, because it still is quite a diverse situation around the world. And Delta is dominant still globally. So the situation will unfold in the coming days and weeks. And I think we all have to recognize, as was highlighted in the last question, it will take some time for us to get some answers. But as the experts work and release this information to us, we will update you as regularly as we can to give you information and update on what needs to be done. But we cannot emphasize more that we're telling countries not to wait, but to act and to accelerate vaccination, because the vaccines work against Delta. And even if there is reduced efficacy for Omicron, it's still better to be vaccinated than not. So those of you who are out there who may be hearing all of this information, it may sound scary, it may be confusing, but as the experts are working this out, what's important is what you do, and you keep yourself safe, and you take measures to reduce your exposure to the virus, no matter what variant is circulating where you are, and you get vaccinated when it's your turn. And we work very hard to increase vaccination coverage in those who are most at risk in all countries.